The next is premium assistance. That ties into that case as well. And there's Section 2001, Medicaid expansion. So folks who actually voted to support Healthy Michigan and support Medicaid expansion, all that they were doing was enabling Section 2001 of the Affordable Care Act. And then last but not least is where we start getting into the exploit area here. And it's Section 10,104. Yes, it's way at the back of the bill. And it's this thing called a Qualified Health Plan Amendment. And it allows for something called direct primary care medical home plans. Essentially, it's a modification to the default section of the late night amendment to that Section 1301, talking about how do you get a qualified health plan. Qualified health plan is important because that keeps you out of trouble with the IRS. If you don't have a qualified health plan, that's when you start paying penalties. So this modifies the terms of what can be considered a qualified health plan. And essentially what it does is separates out catastrophic care, the stuff when things go bump in the night for hospitalization, from primary care, i.e. your routine care, your preventive care. And the key word is direct in that. And why is that key? You see all those organizations, 159 new organizations under Obamacare that have been erected between a doctor and a patient, they disappear in a direct primary care arrangement. So now you're back to doctor-patient relationship. So when I talk about some of the good things that are in the Affordable Care Act, this is the front row and center as far as what I think are one of the good things that we can go off and exploit in the current healthcare law. All right, this doesn't blow up very well, but it gives you an idea of where some of the big costs are inside of our healthcare system. I'll go back to that stated objective again. What was one of our key objectives? To lower healthcare costs. Here's a history of the increase ever since Medicaid, Medicare were implemented out in the 70s, of how the number of administrators and the growth of administration has exceeded the growth of the people actually doing the health care and actually providing health care services. So on the bottom, that thin red line, that's the growth of physicians. Up on top, that's the growth of administrators. Now this only takes it up to 2000, oh man, my eyes are really bad now, but of course I think everybody's eyes are bad if you're trying to read that one. It's around 2009 timeframe. So this is pre-Obamacare. Since Obamacare, we've added another 159 new organizations on top of that. Administration is just going through the roof. And I don't know how many of you have noticed this, but there's a lot of doctors now that the idea of hanging up a shingle outside and having a private practice is kind of going by the wayside. Remember the old Norman Rockwell paintings? That type of practice doesn't exist anymore, or it's very rare when it does exist. A lot of the doctors are going to hospital-based systems or larger networks. You know why? They can't deal with the overhead necessary to deal with our spaghetti diagram. And so my wife, when she was working at a private practice out in Brighton, I remember one day that I spent the whole day replacing 31 fluorescent light bulbs in the patient rooms because they didn't have the time to go off and do some of the basic maintenance activities. I was doing all their data backup and recovery for them as well. They could not handle all the administrative backup. All their time was focused on taking care of their patients or making sure that they're following up on labs. They did not have the time to do the blocking and tackling and a lot of the paperwork, and their accounts receivable were horrible. I mean, there was no way to follow up with a lot of that. And accounts receivable in our current system, it was bad enough as it is. It means that it's tough to, when you have a 6-month delay when you get paid for a treatment that was provided 6 months earlier, it's tough to keep money flowing in the right direction. So a lot of hospitals or a lot of doctors are hiding underneath the protective cover of a hospital-based system where they can provide all those administrators. And when you do that, you're losing control over your decisions as a doctor with your patient as well. So now you have to start following a whole bunch of different rules that are going to be put in there by people with MBAs instead of MD degrees next to their name. So what I'm proposing is the way to deal with all this is to go back to that patient-centered care solution. This is the heart of what I'd like to really zero in on today as a bright spot on the horizon of healthcare reform. This solution has been demonstrated to actually lower costs, improve quality and coverage, and protect consumer choice. It's actually one of the free market nuggets that's out there right now, And it's starting at the grassroots level across the country, and I'm going to give you some tools on how you can engage or invest